Hello. It's hard to believe that we are getting to the end of the semester, and I just wanted to meet with you to provide you with some information about the upcoming paper, the final conceptualization paper. So the paper is coming up, I believe it's in week 15 that it's due, but I strongly suggest that you not wait until the last minute to begin to plan for it, as it is a rather involved and intensive process. It's collective, it's progressive. So it's asking you to utilize information that you've gained over the semester in this course and other courses and develop this conceptualization of the client and what you would do with them. So Alex has been our client now. We've seen her by the time you arrive at this assignment for 10 weeks. You should have a really deep understanding of her issues as they present related to trauma, supports that you can use for her interventions. A lot of the feedback that I gave during the assignments was to prepare you for this assignment so that when you get ready, you're able to provide some depth to what it is that you are explaining, as well as some insight. I want deep answers with the information, not just you repeating what the episode was. I'd like you to make sure that you're utilizing inferences where you are reaching conclusions. A lot of the information was not given about Alex, but as a clinician, sometimes we have to infer and look at what's the situation, what is this really saying? For instance, no one said during the episode that Alex demonstrated codependency behaviors necessarily, but as a clinician, that's something that you may have wanted to that you should have picked up on. Like, she didn't feel that she was responsible to her mother and Sean, but she felt she was responsible for their actions. That's a difference. So you may want to consider those sort of things as you're delving into doing this paper, because it would be like a summary that you might be writing as a case assessment, handing this file over to someone else in the agency, or if you were asked to present a case. So I want some depth and insight to your answers. I want your point of view as a clinician. Be really careful in making sure that we're highlighting her strengths as a client and not looking at what we believe she should have done, or just shooting on her, SHOULD, not allowing her space in her own trauma story, where we come in as clinicians with judgment around what we believe should be happening for the client. So as you write this paper, think about her details and the demographics. Those things will be easy for you to identify. But also, I want you to consider the presenting problem as it is related to her traumatic experience. What is the most presenting concern that you have after 10 weeks of sessions with Alex and getting to know her life? What would you say is that primary problem, and what thematic problematic beliefs are related to those? What negative beliefs has she adopted? What are her cognitions, things that she believes about herself, both negative and positive? And you can get those from a cognition list. You can look up the negative cognitions, or you may have already been exposed to cognitive behavioral therapy in your other courses and understand the core cognitions. Like, what is that true belief? Like, I'm not enough, or I must be in control, that shows up in Alex's life. The next is that I'm asking you to include her story, the who, the what around her childhood history and developmental milestones. For instance, you may want to consider around a milestone that it came up as a flashback, but we know that Alex was in an abusive household that she hid in closets and cupboards. And so when, where, how was her traumatic experience shaped? What's her trauma story? Also, give me a summary of the cognitive processing during the trauma. If you were to have engaged with Alec, how do you think she would respond? Would it be attachment, cry, flight, freeze, appease, please? You want to go back to those beginning notes from the videos that we watched where we learned about these trauma responses. Also, you want to give information about her adverse childhood memories that show up in her life, adverse childhood experiences. If you're familiar with the ACEs, Adverse Childhood Experience Scale, there's 10 adversities that can happen in a child's life. Alex experienced many of those. Talk about that, as well as what coping strategies might she use? So you just spent another 10 weeks doing mindfulness meditations, learning about resourcing and stabilization. Which ones would be good for Alex? Some of them you began to use towards the end weeks when I challenged you to consider the intervention. Some of you wrote very well about which interventions you would use, even use them as your treatment goals. Go back, pull that information from the power notes that you've been doing. A lot of that information is going to help you to craft the assignment. Also, I'm asking you to do a screening. So I provide the trauma history questionnaire, trauma history screen, the finding your ACEs score. Select which one you want to use with Alex and complete that. And then you're going to write a little summary about it. Part 3, I asked for resources. What are some resources, some protective factors that might be available for Alex? Again, some of you in your power notes did a great job in identifying local, like Catholic Charities or someplace safe house that you might have referred her to. When you're doing these, consider what resources are available in your area that if Alex were your client and you were the true clinician, that you might be referring her to. What resilience factors that she might have, including spirituality, if that's applicable. What social supports? Nate was a social support. What other supports? The center, writing, her writing group. I want you to delve into considering what protective factors, or even I think I also ask about risk factors, did she face, but what was there to help her? Talk about her behavioral dysfunction, identify some of the horizontal factors that aren't just direct, like job loss or lack of a job, her finance, what illnesses showed up, were there any disabilities, what about vertical stressors that occurred in her past, that such as being a survivor, how do those attitudes or labels or family secrets or stressors show up for her? Part 4, I'm asking you for a diagnosis. What diagnosis would you use for Alex? And again, this isn't as much about the right or wrong as much as you going through a process and be able to pull all the information together into this case conceptualization, this final summary of the client, which is why the power notes each week were really important in gathering information. So it's more than just reporting what happened. It's with that clinical eye looking in, making those inferences, and being able to come to, based on this, this is her diagnosis. Of course, you would use the DSM-5 for that. And what about the demonstration of, the last part, is a demonstration of the stabilization and intervention. So I want you to base it on Alex, based on your interaction with Alex, maybe other interventions that you suggested along the time. Do a demonstration. So you can have, you can do it as an audio, you can do it with a person face to face if you're more comfortable doing it that way. But you're asked to submit a 5 to 10 minute stabilization. And with that, I don't want you to do the script, right? I challenged you last week, hey, start thinking about how you might make this your own intervention that you could really use it with a client. So this is the week when you're doing this paper that in that demonstration, you make it personal. You actually might use Alex names. You might say, I want you to float back and think about this specific memory and include that memory in that, and then ask her to visualize something different. If you take her to a safe place, maybe whatever it is, I want you to make it personal and be more than a script so that you can assist her through it. You might want to select the power of letting go or the awareness of positive and negative emotions. I wrote that you can use those, or centering the heart to serve for your demonstration. Those are examples. If you have another one that you feel more comfortable with, that's fine. Just do that and provide that to me. You'll upload that, as well as a summary of Alex is small t or large t, how or why the resources that you selected can be part of her treatment. And then conclusion, I'm asking you to discuss the implications for this course, for your professional and personal growth. How has your competence changed or grew through the process of developing this frame? Excuse me. I'm sorry. Developing this framework, utilizing mindfulness and meditation as a stabilization resource in trauma treatment. You may not agree with it at all. You may have totally hated doing the practices. The point is that it's evidence-based. It's very useful. Mindfulness and meditation and stabilization are a part of all major trauma therapies. In the trauma treatment world, we use it for cognitive behavioral therapy. We use it in EMDR. We use it if you're doing dialectical behavioral therapy, somatic psychotherapy, mindfulness and meditation. They work. It's evidence-based that it prepares the client and working to target. So again, whether you enjoy it or not, it's evidence-based. Write about the implications of the course, and you're welcome to write that you hated it, that you didn't like doing it at all. That's an implication for growth as well. And then conclude by identifying at least 2 specific practices that you can commit to. Because again, we are building our resource for what helps the client, not necessarily what we enjoy. So what are 2 practices that you might, I'm so sorry, that you might consider integrating into your practices? Maybe it's just breath work, maybe it might be one of the specific meditations. Maybe you say, I don't want to commit at all. No right or wrong answer, but I just wanted to give you an overview of what we'll be expecting for the paper. Again, I'm expecting it to be at a level of depth and insight of a 16-week experience, right? It's at the end. You should know a little bit more. Tie in from the beginning. The first 4 weeks was really good about setting the trauma base around trauma-informed principles, fight, flight, freeze. I'm asking questions that go back. So you may need to go back and look at those modules. But come to me or come to the paper with that sort of insight. And if there are things that you learned in other classes that support how you write, that would be wonderful as well. So it's just a brief summary of the case conceptualization. Please do not wait until that week to do it, or it'll reflect it. You have some time off, and I hope that during that time you enjoy your family, and then you come back ready to conclude our course and finish strong. Have a great Thanksgiving and be well and take care.